Right. Welcome to another chat with West. That's me. Um, I'm sitting outside today. It's beautiful, and in the sun, it's somehow hot. I think it's only like, I don't know, 50 degrees or something. But that sunshine feels good. So I thought I'd come outside and do a little video. Today's topic is going to be about transgender care and incorporating culturally sensitive care in the medical field, or I guess you can really apply these to like any general office. The reason that I'm doing this, or that it even came to my attention, is because the occupational therapists at my work are going to be giving a talk about incorporating LGBTQ culturally sensitive practices into the setting, which is the hospital that I work at, and they've asked me to kind of help them do some research and give some insight and things that make me comfortable or not comfortable with seeing a provider and seeking healthcare. So, a lot of it's going to be just, I'm coming out of, so this is the Gay and Lesbian Medical Association, the GLMA, nice little handbook that I printed. And any of the websites, I wish I could figure out how to like put them right here or down here or up here or over there. I don't know how to do that. So I will give you the websites, and if you want further information or you can't quite understand what the hell I'm saying, just message me and I'll send them to you directly. So this is glma.gov, and unfortunately, on the first page, there's something that strikes me as very, very sad. I'll start out by saying that the statistics show that LGBTQ populations are a lot less likely to seek out medical treatment or medical help due to either discrimination, body dysphoria, feelings of being persecuted or dismissed or not believed, people not understanding, medical workers who believe something different, and instead of treating them as they should with no bias, they find that they are treated with bias and don't receive proper health care. So instead they choose not to go to the doctor or not to seek help for a problem, and that leads to more serious complications and diseases and infections. And so yeah, I guess I just want to kind of bring some awareness and some statistics. And so literally the first paragraph, studies show that lesbian, gay, bisexual, transgender, and LGBTQ populations, in addition to having the same basic health needs as the general population, experience health disparities and barriers related to sexual orientation and or gender identity expression. Many avoid delay of care or receive inappropriate or inferior care because of perceived or real homophobia, biphobia, transphobia, and discrimination by healthcare providers. Now, as a nurse, if someone comes into where I work and they say, hey, I have these cultural considerations or these ethnic culture considerations, and I would prefer when you speak to me for me not to make eye contact with you, or I would prefer that you cover your tattoos during my assessment so that I'm more comfortable, because in where I come from that's not acceptable. Or that's our job as healthcare professionals, is to sort of provide like a holistic sort of care for this patient. It's not just what they came in for. It's not just what we can do for them preventatively. It is also about tailoring our assessments and our treatment to their needs specifically. And so my first recommendation would be, treat somebody who is LGBTQ just like you would anybody else. Any other patient. I don't care what you believe. I don't care if you're against it. I don't care. Simple example, if you're Christian and you have a Muslim patient, are you going to treat them any differently? If you are African American, are you going to treat a white person any differently, or an Asian person? Or no, because it's our job to make sure that that person is taken care of holistically. So why don't you just throw LGBTQ right on in there with religion and culture and ethnicity and background, and why not? So that seems obvious to me, but I thought I'd say it because that's literally the first paragraph of what the GLMA says. A few other just kind of random or important things that I noted. Here's some good. So, if you are a trans person, LGBTQ, and I hate saying that acronym because it's so long, and if you are of a different persuasion than anybody else, whatever, there's actually two websites that I really recommend as far as trying to find like your healthcare team. It'll direct you to people who are LGBTQ friendly, and one of those is the www.glma.org. That's this website. And then also www.gayhealth.com. That's another great website. That's actually how I found my primary care provider. And she is a nurse practitioner. She is extremely amazing, very kind, considerate, listens to what I have to say, asks all the appropriate questions. There's also, if you can find a local chapter of some sort of gay-friendly organization or group, they may have recommendations for providers that other people have used, that you can use, that are going to be appropriate and consider your needs specifically. Now, I'm a huge proponent in open dialogue. It's very, very important to be open with your patients and to treat them with empathy, and that you care and you want to know, and that what they have to say is important. Just like any other human. Honestly, people, we're humans. We just want to be treated like any other human. And so if you are either in an office or a medical practice, or there's a few things actually like that I found that can help those populations feel more comfortable, either seeking care from you, or when they show up to the office, they're scared, they're nervous, they're anxious, they're thinking about all these things in their head of previous providers they've seen, and these are things that can actually help them to feel more comfortable. One of them is, I believe if you go to the trevorproject.com, that's an amazing website, by the way, with a lot of good resources, you can actually print out like a sticker logo, and it is recognizable by all of us that you are a provider who sympathizes, empathizes, and supports LGBTQ rights. It's free, it's downloadable, you just print it out, you stick it on your thing, like your window office, your doors, your wherever. I've actually seen that now. I mean, granted, I live in North Dakota, which is a pretty red state, but I've seen that now on at least 4 or 5 different providers' offices. It's literally just as the door that you're coming into their office. It's just right there, and the ones here that I've seen, it's a rainbow flag, and it says something like, "We support everybody," or "We care for everybody, no matter what." And that automatically makes me feel more comfortable, knowing that they are going to be kind and compassionate and empathetic to my situation and take me as an individual. So that's one thing. If you have sort of pamphlets set out in like your reception area where the check-in is and the lobby and all that, you can maybe put out some LGBTQ flyers or pamphlets. If you list support groups for other conditions or whatever, maybe list some of those in the community that are for LGBTQ. That's, again, very reassuring. Not only that, but it's a great source of information. Sometimes people don't want to ask for that sort of help, like support groups or information and education. And if it's just there, sitting there, studies show, I looked it up, hold on, studies show that you're 27% more likely to attend if a free pamphlet is offered at the front of your doctor's office. So, keep that in mind. Let's see. Another thing to be aware of is also remember the health problems of somebody of their birth gender. So, for example, my doctor is I still have to go for pap smears, as uncomfortable as it is, but she's very aware of that and she recommends it. And although I'm male, she still encourages me to do breast exams and to make sure that I'm paying attention to those sorts of things in my body. So it's really important that we make sure that we are assessing not only for their their considered gender and their identified gender, but also the gender they were assigned at birth, so that we are catching and making sure that we catch these problems early on, just like we would anybody else. And for example, when I had my top surgery, my breast removed, the doctor said, just like I would any other woman that I'm doing a mastectomy on, I would recommend, yes, it's extra and it costs, but I want to send your breast tissue out to the Mayo Lab at the Mayo Clinic and have them test for any genetic markers that might even look like breast cancer, even though you've never had a problem, you don't have much of a history in your family. And I felt that was really sort of empathetic, something I would have never even thought about. I would have said, just chuck it, whatever, it's done, it's off me. But again, being sensitive to the specific needs of somebody who is undergoing some sort of genetic gender reassignment surgery, or gender confirmation surgery, as I prefer. But okay, so let's see what else is in these packets. And I know this video is a little lengthy, but trust me, it's worth it. Especially if you deal with any sort of population that might be LGBTQ. And again, especially in medicine, just because we are there to serve our patients and we are there to serve other people. And I feel like we need to do that in an appropriate way that is not just all-encompassing, but also respectful. So, another really important thing, make sure you're assessing for sexually transmitted diseases, and albeit the conversation about being sexual is very uncomfortable, you're a provider, get over it. As long as you're asking in a respectful and appropriate way, I don't think, honestly, anybody's going to be offended. Don't ever assume just because someone identifies as a trans male that they're automatically attracted to females. They could also be attracted to males, they could be bisexual. Your gender identity and your sexual identity literally have nothing to do with each other. So there's everything from I'm cisgender male and gay to I am cisgender female and bisexual, and literally everything in between. So just be aware of that. So don't assume who their partner is or what their sexual identity is based off of their gender. Hold on, I know I had a few more comments up in here somewhere. Sorry, this is a lengthy packet. It's like 78 or 79 pages. Let's make sure we're assessing for any sort of symptoms or signs of depression, body dysmorphia, anxiety, and then let's provide those people with resources. It's really important to make sure that they have maybe an ongoing therapist that you can recommend or even help them find, that you can refer them to. If you're ever unsure as a professional where to go, coolest thing about today's day and age, literally go to www.google.com and search for therapists in whatever city that you're in. It's that easy, people. Don't be lazy. Get off your ass, do some work, and I guarantee you that your patients will thank you, and you will feel better at the end of the night when you go home knowing that you have helped that person, even if just a little bit. You've helped that person sort of find some resources and some help. So, other than that, I will point out I found a really good article at the Journal for Nurse Practitioners, and that website would be www.npjournal.org/article S1555. And this is about delivering culturally sensitive care to LGBTQ patients. I'm not going to go over all of it. It's kind of lengthy and a little wordy, if you can get through that. But it points out a few good statistics, and one of the most staggering to me, given recent events, if you've been following my pages, is transgender and or I guess LGBTQ in general are between 2 and 5 times more likely to commit suicide based on harassment, bullying, body dysmorphia, gender dysmorphia, sexual identity dysmorphia, and up to 78% of all LGBTQ people have been harassed either verbally, physically, or sexually in their life, versus the statistic for cisgender people, which is closer to about 33-34%. So understand that you're dealing with a population that is very emotionally sensitive. We've been through a lot, and I myself, having had a history of abuse and harassment, and I can speak to that, as when I go to a provider, at first, I mean, I'm very uncomfortable. It takes me a little bit longer to develop some sort of rapport with these people and to feel comfortable sharing with them exactly what I'm feeling and my symptoms and my problems and what I need addressed. And so just be aware, be sensitive. Again, if you need more resources, I have literally stacks of paper and places that I've gone to for research. But if you need more, please feel free to contact me. I'm actually quite surprised. There's some people out there that have been contacting me and asking me some really, really bizarre questions. But you know what? I'll take it. I'm here to answer anything. And I'm getting a weird look from my neighbor. I don't really care. But anyway, please message me if you have questions. And I'm always here for you guys. Questions, support, love. If I could drive wherever you are, a big hug. But just let me know. Thanks for watching, guys.